For my third Sports Medicine 3 project, I did injury prevention on carpal tunnel syndrome. My client is a 36-year-old female who suffers from chronic carpal tunnel syndrome. She has had this for about 3 years. She has had one surgery and attended physical therapy for over a year. As of now, she still needs one more surgery. Carpal tunnel syndrome is caused by pressure on the median nerve. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of your hand. When the median nerve is compressed, the symptoms can include numbness, tingling, and weakness in the hand or arm. The causes of carpal tunnel syndrome are typing and using a mouse excessively on a daily basis, repeating movements while working, playing a musical instrument, or playing sports. These can cause bursitis in the tendons that surround the carpals, which could lead to CTS. It is highly prevalent in people ages 30 to 60, and it affects females more than males. For my baseline testing, I did the Fallon maneuver first, which is where you have the patient place their wrist in complete unforced flexion for 30 seconds. If the median nerve is entrapped at the wrist, this maneuver reproduces the symptoms of carpal tunnel syndrome. As you can see here, her hands are not completely together and her elbows are relaxed. And then in the second position, her elbows are also relaxed, but also putting pressure on the fingers. The second baseline testing I did was wrist extension and wrist flexion. These are performed by straightening your arm and bending your wrist back as if signaling someone to stop. Then using your opposite hand to apply gentle pressure across the palm and pull it towards you until you feel a stretch on the inside of your forearm. She held this stretch for 15 seconds. The third baseline testing I did was medial nerve glides. This is a 6-figure stretch, and it is where you make a fist with your thumb outside your fingers, and then you extend your fingers while keeping your thumb close to the side of your hand. The third is to keep your fingers straight and extend your wrist and bend your hand backward towards your forearm. The fourth is to keep your fingers and wrist in position and extend your thumb. The fifth is to keep your fingers, wrist, and thumb extended and turn your forearm palm up. And the fifth is to use your other hand to pull on your thumb. As you can see here, she did perform these kind of quickly, but she did tell me that she felt a lot of pain while doing these. For the fifth baseline testing I did tendon glides. There's 2 series to these, and the first one I didn't do a video, but you straighten your hand in front of you and your wrist straight, and then you bend the tips of your fingers to create a hook and your knuckles pointing up, and then you make a tight fist with your thumb over your fingers. This causes the tendons in your hand to contract and cause tingling in your elbow. The second series is where you straighten your hand in front of you, your wrist fully straight, and all of your fingers straight up, and then you make a tabletop or duck looking shape with your hand with your fingers by bending at your bottom knuckle and keeping the fingers straight. The third is to bend your fingers at the middle joint, touching your fingers to your palm. Also, thumb opposition. Thumb opposition refers to the ability to turn and rotate the thumb so that it can touch each fingertip of the same hand. The client didn't feel any pain with this, but had a lot of trouble, which means she had poor thumb dexterity. For the program, I did wrist lifts, which is where you place your palm on the table and lift the fingers up, and place your other hand across the knuckles at 90 degrees and push down as the bottom hand tries to pull up. This causes force on the tendons while trying to contract at the same time, which can be painful but also beneficial. She said she didn't feel much pain with this, but it felt like she was gaining strength. The second thing I did was wrist stretch with light weight, which is where she was holding a bag of beans frozen beans, to stretch her arm in front of her with her palm and slowly bend her wrist upward and downward in a controlled motion. This she did feel pain with, considering there was weight. The third was hand squeezes with a rubber ball. We used a tennis ball because it's all we had, and she squeezed for 5 seconds and released for 3 seconds, and then did 3 sets of 10 repetitions. For the third, fourth, and fifth program exercises, we just used stuff from the baseline testing, and she just did them throughout the 2 weeks. My client did work individually for the duration of the program, as we both had busy schedules, and she said that she enjoyed doing it very much. The post-testing was measured in percent pain decrease from pre-testing. The Fallon maneuver, the pain was decreased by 35%, wrist extension by 30%, wrist flexion by 40%, thumb opposition by 80%, medial nerve glides by 50%, tendon nerve glide series A by 20%, and tendon nerve glide series B by 10%. What to do if you experience carpal tunnel syndrome? It can be treated easily, and symptoms tend to be worse at night, so you should hang your hand out of the bed or shake it around to ease pain. Certain activities can bring on symptoms. Wearing a working wrist splint may be helpful. Trying these exercises in this program can help to ease pain and prevent future injuries. Thank you, and that's it.